Jameis Winston went down with a very graphic looking leg injury today, and this was a very concerning one right away because it resulted in him needing assistance to get off of the field, and eventually he was carted to the locker room. Now, on the play that Winston was injured on, we saw that as he was rolling out of the pocket and going for a scramble, he was pulled down to the turf. As he did this, that left knee just went into a very awkward and very painful looking position. Now, currently, unfortunately, we do not know the exact injury that he is dealing with, but some sources are just classifying it as a leg injury, and others are actually specifying and saying that it is a knee injury. But the position that his leg went into is actually very risky for the knee, and since some people may not be too familiar with that, I'm going to go ahead and focus on that with this video. Welcome, sports fans. For those of you that aren't familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries, and I try to explain them so that they are a little bit easier to understand. Then I'll go over into the anatomy of that specific injury, and then if we know enough about the injury, I will go ahead and talk about the rehab process. Since this is a very new injury and we don't know any details as of right now, I'll go ahead and go over what structures are at risk in that leg position, and I'll go over the best and worst case scenarios. If you like this video and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehab, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now, we can see here that as Winston is scrambling out of the pocket, as he's being brought down into the turf, we see what looks like his foot sort of get tangled up there, and his knee and leg just go into a very awkward looking position. Now, first I'll go over the general anatomy of the knee joint. And so the knee joint is formed by this femur bone, which is located in the thigh. That's going to travel on down just like this. And the two bones in the lower leg, you have the tibia and the fibula. They are going to come up just like that. There are 4 ligaments in the knee that contribute to overall stability. And so the first one that we often hear a lot about is the anterior cruciate ligament, or the ACL for short, which is located in through here. As we go to the inside of the knee, or the medial portion, this is the MCL, or the medial collateral ligament. As we move towards the outside or the lateral portion of the knee, this is known as the LCL, or the lateral collateral ligament. And finally, on the back here, this is where we see that posterior cruciate ligament, or the PCL for short. Also, you have these 2 structures that are colored blue here. They are the medial and the lateral meniscus. You can think of these 2 structures as shock absorbers between the 2 bones. Now, as we look at the injury video again, we see that as Winston is being pulled down into the turf, we see that his foot is slightly externally rotated, and the exact name of this position for the foot is known as eversion, but the foot is externally rotated in that eversion position, and we see what looks like that knee sort of bend very awkwardly as it dives in like that. Now, if you've seen any of my other videos, one that comes to mind is the one I did recently on Robert Tunyon, but as a person is being pulled into this position, this is known as a dynamic knee valgus, and it's very risky for a lot of structures in the knee, but the one that is probably at most risk, of course, is that ACL. And you can see that on this model here, that as I externally rotate the lower leg, and this knee starts to dive inwards, you can see that this ACL actually gets very taut and very stressed in this position. We actually see frequently where players' knees will go into this dynamic knee valgus position even in a non-contact play, and this is enough to damage that ligament. So in an instance where an individual is being pulled down by another person, that places an immense amount of force going through that ACL. Also, as you can see, as I'm doing that, not only the ACL is getting tight and getting force going through it, you can see very clearly that the MCL is also having a lot of tension through it right here, and this can also affect the medial meniscus. Now, there are instances where a person goes into this position and all 3 structures are damaged. This is known as a terrible triad injury. As of right now, we don't know the specifics of this injury, but it's very important to know that this is such a very risky position for the knee that more than one structure can be involved. Now, here I have a model of the foot, and I have this because as we go back and we look at the injury as well, there is a possibility that he could be dealing with another injury on top of the knee injury. We see that as he's being pulled down into the ground, once again, that foot is in that eversion, causing that external rotation. And as you do this, this is putting a lot of strain on the ligaments that actually hold the tibia and the fibula together. So the tibia is here, the fibula is here, and you actually have some ligaments that help keep those bones together. As a person goes into external rotation, you can kind of see on this model, but it's going to separate those two bones. And if the force is great enough, it can really affect those ligaments as well. The ligament located on the front or the anterior side is known as the anterior inferior tibiofibular ligament, and it spans right in through here. And as we go on to the back, there is another ligament known as the posterior inferior tibiofibular ligament. Now, when these ligaments are affected in any type of an injury, we refer to these as a high ankle sprain, but usually the mechanism of injury is when a person's foot is externally rotated or going into that eversion position, which is placing that distraction force between the fibula and the tibia. Now, although this position is very risky for the ankle and the knee, I think as of this point, it's looking like he is dealing with more of a knee injury, and I'm thinking this for several reasons. First of all, the dynamic knee valgus position is extremely risky for those ligaments, and once again, we've seen that a lot, and I have done several videos where a person's knee is going to go into that position and they're going to ultimately have a knee injury. Also, as we look at the behavior of the trainers, I know we only get a few seconds to essentially see what they're doing, but they do not seem concerned with that ankle at all. They really seem to be focused on that knee area, and that's where they are positioned. So unfortunately, we don't get a lot of video to see what tests they're doing because there are a number of on-field tests they can do. And based on them doing those tests, we can infer that that is what they are concerned with. But it looks like as of right now, they are predominantly concerned with that potential knee injury. And we're just essentially going to need to wait and see how severe that will be, because that can greatly impact a person's recovery time. Depending on the ligament that is affected in the knee, there is a grading system, and this of course is grades 1, 2, and 3. In that grade 1 injury, the person is going to get a stretching of the affected ligament. In a grade 2, they're getting stretching and partial tearing. And finally, in a grade 3, this is where they're going to get that full rupture. This, of course, can only be determined through that MRI. So I really expect that as of right now, Winston is going to be having that MRI. And unfortunately, we're just going to need to wait and see the results of that. If a person is dealing with a grade 1 ligament injury, typically they're not going to experience any instability in the affected area. So if we're talking about the ACL or any other structure located in the knee, if it's a grade 1, this will not affect stability usually, and this person can usually return to normal activities anywhere between a few days up to about 2 weeks. So this is obviously the best case scenario. When we move into a grade 2, this is when this starts to affect stability in the knee. This is due to because of that partial tearing. So this can take anywhere between about 4 to 5 weeks up to maybe a couple months. It really just depends on how severe it is. And finally, of course, the worst case scenario is going to be if it's a full ligament rupture, because depending on where it is, that can really indicate surgery. So once again, we're just really going to need to wait and see until we see more specific information regarding this injury before we can form an accurate timetable for his return and an accurate treatment plan in the rehab world. If I happen to hear any updates regarding Jameis Winston's injury, I'll be sure to update everybody in the comment section. Also, if there is any breaking news or anything like that and you want to share it with everybody, please feel free to post it. And that's it as of right now regarding Jameis Winston's leg injury. I really wish him the best moving forward because he's been having a killer season so far, and I hate to see him go down like this. So I really wish him the best of luck moving forward. Once again, if you like today's content, please subscribe to the channel because I will be making more videos in the future. Thank you for tuning in, and I'll see you next time.